alaikum, and thank you for being here so early in the morning. I'm very excited and very honored to be a part of this conference and to present our research on the American Muslim community. ISPU, the Institute for Social Policy and Understanding, is an education and research organization that focuses entirely on the American Muslim community. And we've been conducting national surveys of the American Muslim community now. This is our third year. We're actually about to come out with our 2018 poll on May 1st, so look for that. I'm really honored to be able to present our 2017 poll to especially this group because of the importance of mental health to the American Muslim community, and I'm excited to share some of the results of last year's poll in regards to specifically this topic. You can read the entire report online at ispu.org/poll. I'm going to briefly go through the methodology and then the key findings. So very briefly, our methodologist, our chief methodologist is Dr. David Vabren, and he is the leading authority on how to poll Jewish Americans. That's actually how we found him. He, any poll you'll ever read in the paper on what American Jews think, Dr. Vabren is going to have probably conducted it. So he, as a part of his organization, has really refined the methodology of how to find religious minorities that are very small percentage-wise, 1 to 2%, that are not part of the census. And so he has now reapplied that same methodology to quality representative polling of American Muslims. Our poll was nationally representative, and our sample size of Muslims was 800. We also polled American Jews, Protestants, Catholics, and non-affiliated Americans as a part of this survey. So all of these religious communities or non-faith communities got identical surveys. And so we were always keen on studying American Muslims within their country's faith landscape, not as an isolated specimen. And the survey was conducted in January of 2017. We had some amazing advisors, including Carroll, David Vabren himself, Rachel Gillum, and Amani Jaman were all advisors on this poll. So our key findings, this is sort of the summary. American Muslims are the most ethnically diverse and the youngest faith community surveyed. American Muslims face similar social challenges as other American faith groups. They are, however, less politically engaged, but equally invested in their country's welfare. And I'll explain some of that. They disproportionately feel the negative effect of the current political climate, but they respond to prejudice with resilience and solidarity, and especially when it comes to Muslim women who defy stereotypes. While they bear the brunt of Islamophobia, they're also the most likely to resist. So just a basic foundation on the demographics of the community. Muslims are the youngest faith community. Their average age is actually around 25 years younger than the average age of the general public. So almost a quarter of the community is between 18 and 24. And this is only looking at the adult population, 18 and older. Muslims are the most ethnically diverse faith community, so it's the only community with no majority race. As you can see, when it comes to Jewish, Catholic, Protestant, non-affiliated Americans, majorities of all of those communities are white. The Muslim community is about equal portions, people who identify as black, as white, as Asian, and as Arab. We also have 7% who identify as mixed, 5 to 7 to 8% who identify as Hispanic, and then we even have 1% who identify as Native American, and then there's a group that's just other. So before anyone asks how come there's 24% who say they're white, that's literally every presentation I get that question. White is a self-identification. We're not sort of assigning that to anyone. It's whatever the respondent says they are. White Muslims are not just white converts, okay? Turkish Muslims are white, Persian Muslims identify as white, Bosnian Muslims, Chechen Muslims. So there's an entire population of immigrants who identify as white, as well as Arabs. And many Arabs identify as white as well. Even though we explicitly gave Arab as an option, that's still a possibility. So the 24% is what we get every single year. It's what Gallup got. It's what Pew got. So that number has been consistently measured. Now, most Muslims are the most likely to be born outside the United States. So basically, half of Muslims are native-born, half are born outside the United States. And of the total Muslim population, 14% are non-citizens. Muslims are also the most likely to report low income. This is a statistic that for some strange reason is always a surprise. For some reason, we've been told the story that we're all rich, and we're not. 35% of Muslims are actually at or just above the poverty line. And so I think that's a really important piece that often gets lost in conversations about the American Muslim community. Muslims, though, have education levels on par with Christians. So while we have this sort of disproportionate percentage of our community that is living, that is poor, on average, our education as a community is really no different than Christian communities. Now that is the background, and a lot of things about the community demographically are unique, but Muslims are also part of the American fabric, and part of that means we face similar social challenges as other faith groups, starting with racial tension inside our community. So I mentioned that we're the most ethnically diverse faith community. Something that comes with that is that Muslims are the most likely to report community racial tension. Another issue that maybe doesn't get talked about enough. But this is a question where we asked all respondents, how often, if at all, have you personally experienced discrimination by another member of your faith community because of your race in the past year? 15% say rarely, 14% say occasionally, 4% say regularly, and that's in the Muslim community. 66% said it never happened. Now you'll notice that Jewish, Catholic, Protestants, non-affiliated are all much higher, much more likely to say never. They're also majority white. So it makes sense that it would not happen as often if you are a more homogenous faith community. However, when you just look at Black Muslims and you look at Black Americans in the general public, both are equally likely to have reported racial tension within their faith community. So Muslims are not more likely to have racial tension. They are just more diverse, so it's happening there's a lot more likelihood that someone will have experienced it, because African American Muslims are actually as likely as Arab and Asian Muslims to report having experienced discrimination from another Muslim because of their race. It's not just one group that's reporting it. Now, Muslims are less likely to experience racism from other Muslims than they are from the general public. They're much more likely to have experienced it from outside their faith community. Domestic violence is another issue that often gets brought up in regards to our community. Well, we looked at this across the board. Again, we didn't just look at Muslims. The question was, do you know a person in your faith community who was the victim of violence from someone in his or her family in the past 12 months? Now, it's important that we see this kind of data first, because I think anyone, 55% 64% across the board. That's what people have said in other faith communities. Where Muslims are different, though, is that they're much more likely than other faith communities to also have reported it to a religious leader or a community leader. So imams are being called on to step in these situations more often, to my surprise, than other faith leaders. Despite the fact that Muslims and Catholics and Protestants are equally likely to say that they attend a religious service once a week. So it's not that Muslims are more religious, but they are going to their religious leaders more often for this issue, and that points to the need for training on domestic violence for our imams. And that was my point about religious service frequency is very similar between Muslims, Catholics, and Protestants. Unlike their peers, though, young Muslims are as likely as older Muslims to say religion is important. So, less politically engaged, but equally invested in the country's welfare. Muslims and Jews are the least likely to favor a Trump win. Okay, that's like not the biggest shocker in the world, right? At least we validated that we did have a representative sample, but we still had 15% of Muslims who wanted a Trump win. Still trying to understand those 15%, but there you have it, folks. The majority of Muslims did favor a Hillary Clinton victory. But Muslims are the least likely faith community to vote, to be registered to vote, and to have voted in the 2016 election. Now, why are people not voting? We ask this question. And most times when I talk to audiences, the conventional wisdom among Muslims about themselves is that people don't vote because they think it's haram. That's not true. The reason that people give for not voting is they don't like anyone who's running, or they're too busy, right? Apathy, or they just don't think it matters or it counts. So it's much more about the dissatisfaction with choices or indifference, and it's not theology. So we have to correct the right problem rather than just constantly doing more sermons about the fact that voting is not haram. And younger Muslims, sadly, are, like really in the general public, the least likely to vote. Now, it's ironic that Muslims are the least likely to participate and yet be the most likely to feel the negative effect of the political climate. Most impacted, but yet the least participatory. Muslim families are the most likely to face bullying. So we had 42% of American Muslim families with kids in K through 12 education report having experienced some level of bullying, some frequency of bullying for their children who are in school. Far more likely than any other faith community. So this is bullying specifically because of their religion. Now, that number is already quite alarming and a really important red flag for mental health professionals dealing with Muslim families. But what we thought was even more upsetting was that 1 in 4 Muslims bullied actually were bullied by their teacher or another school official. So 1 in 4 of the incidents involved an adult who was in charge of safeguarding that child as the actual bully. Muslims are also the most likely faith community to report having experienced religious-based discrimination. Over 60% reported some frequency of religious discrimination in the past year. Jewish Americans are the second most likely, and yet Muslims are almost twice as likely as Jewish Americans. We're also, anyone who's traveled, I think, will not be shocked by this. Muslims are twice as likely, sometimes 3 times as likely, to face secondary screening when they come back from an overseas trip at the border. And perhaps as a result of all of this, Muslims and Jews are the most likely to experience fear and anxiety post election. And I'm going to be a little quicker because I'm running out of time. Now, how are people responding to prejudice with resilience and solidarity? So the first exhibit of solidarity is Muslims are the most likely faith group to support Black Lives Matter. Like I said, 25% of Muslims are Black, so this is not like two, mutually exclusive groups. But among Asian Muslims, among Arab Muslims, there's still they're much more likely than the general public to say they support Black Lives Matter, and especially when it comes to Muslim women. Muslim women, just as a group, are as likely as African Americans as a group to say they support Black Lives Matter. When it comes to what are political priorities, the first is economy and jobs, and the second is addressing bigotry, racism, and discrimination. The third is healthcare and education and poverty. That's what Muslims care about. This idea that keeps coming up that Muslims as conservative people are going to be a danger to the LGBT community or whatever. Those things just don't come up as Muslim political priorities. They're not what Muslims are advocating for, whatever they may believe in their personal sort of ethics. They are not working, their issues are not around social norms in society. Muslims also respond to prejudice with resilience. As a result of the 2016 elections, 11% said they signed up for self-defense classes. 18% said they joined or donated or volunteered at a civic organization for the first time. 23% said they increased their donation to organizations associated with their faith community. And this is especially the case when it comes to Muslim women who defy stereotypes. They bear the brunt of a lot of this, but they also resist the most. So Muslim women are more likely than men to suffer post-election. They're more likely to say that they are suffering emotionally with stress and anxiety enough to believe that they need the service of a mental health professional. They're more likely to have to say that they personally fear for their personal safety or that of their family from white supremacist groups like neo-Nazis and the KKK. Nearly half of Muslim women have expressed this fear because of the election, and around 21% more likely than men said that they have made plans to leave the country if it becomes necessary. And these are all sort of extreme things that we wanted to see. At what level is the anxiety post-election for Muslim Americans? Muslim women, Arabs, and young people are also the most likely to say they have experienced some degree or some frequency of religious discrimination. So when you look at just gender, Muslim women do bear the brunt of Islamophobia. But they're also more likely than men to have taken action post-election. Muslim women more likely than men to have signed up for self-defense classes, for example, as a result of the election. More likely to have increased their donation or associated to an organization associated with their faith community. And then, surprisingly, I think for me, is they were no more likely than men to say that they had modified their appearance to be less identifiable as a member of their faith community. So while having more anxiety, more fear, reporting more discrimination, they are not any more likely than men to hide their identity. Muslim women, as I said, are also, within the Muslim community, among the most likely to say that they support Black Lives Matter. So responding with solidarity. The other kind of stereotype defining findings that Muslim women surpass men in education in terms of the likelihood to have a college and postgraduate education. The other surprise to a lot of people is that Muslim men and women are similar in their mosque attendance. Muslim women are statistically as likely, or this is actually statistically the same, but versus the idea that Muslim women don't need as much space or as much resources because they're not attending as often is not borne out in the data. So to sum up, Muslim Americans are the most ethnically diverse community, the youngest faith community in terms of average age. They face similar social challenges as other Americans. They're less politically engaged, but equally invested in their country's welfare, most equally likely to volunteer, for example. They're disproportionately victimized or feel the negative effect of the political climate, and they respond to prejudice with resilience and solidarity. And especially women defy stereotypes, suffer, and also resist the most. Thank you.
Thank you, Dalia. That was wonderful. We're going to move on to our next presenter, Carroll, who will be presenting the universal language of grief, healing broken souls to build stable societies.
Good morning. Thank you for having me here. I'm not a clinician or an academician or a researcher. I am the widow of a soldier who died in service to his country, and I am a retired Air Force officer. I also spent the last 25 years of my life working in programs that provide comfort, hope, and healing to those grieving the loss of a loved one. Yesterday, Farah Abbasi very beautifully and poignantly opened our conference with 4 words: commitment, community, connection, and compassion. In my time, I'm going to take you on a journey through a non-governmental organization, an NGO, that is doing work here in the United States and now around the world to bring a sense of community to all those grieving the loss of a loved one, and the profound impact that that grief has on their lives and their ability to move forward, and what we can do about it to bring together our global community. Did I do that? Oh, got it. Thank you. In 1992, when my husband was killed in an Army plane crash with 7 other soldiers on board, I found that there was no organization for all those grieving the loss of a military loved one to come together to find support, comfort, normalize our experience, validate what we were going through. And so I began doing research and in a very simple way, searching for the gaps that existed and the needs that were there for healing. I found that in very simple terms it was imperative that we create an organization that would allow family members to come together to find resources and to help each other heal. There were 4 core services that were not addressed anywhere else, and these are services that we now bring internationally. The first of those is just that peer network. It's meeting another person who truly understands the pain and the suffering, the challenges faced after a loss occurs. We also offer casework assistance. It is connecting surviving families with the resources that are available to them, whether it's in the government or in the private sector. It's community-based care, connecting families to the resources and the networks right where they live, and then it's providing that support around the clock. We've had the opportunity now to work in 23 countries, and that's expanding all the time. I spent quite a bit of time in Afghanistan, and this was a mural that was on a wall that we saw just a few years ago. But I love the fact that it is very gently carrying the heart of the country in a wheelbarrow and putting a Band-Aid over a country with a broken heart. Our children that come to the Tapscott Grief Camp to find healing and learn how to cope with the death of a parent are not unlike children in other countries. They share that same struggle to come to understand how to grow up without that parent. So the picture of the little Afghan girl was actually in the newspaper when we were there a few years ago, and it was just, it could have been any child in any country grieving a loss. So what we learned is that grief is a universal language. And through grief, through that broken heart, that desire to come together to find hope and healing, we can bring resilience and understanding and a global community. So the mission of TAPS International is to help our American surviving families who have lost loved ones in the military and in areas around the world understand that their loved one was part of a fight for freedom, for a better world, and for our coalition partners to provide the opportunity for them to understand what we are sharing in the grief journey. We also are providing economic opportunities, employment, financial aid, emotional support, and that community of hope to bring family members together, to know that they are not alone, and to truly understand. We have partnered with the military and in their civil affairs, which was done a bit at a distance. We've now shown them that coming into the community, that building hope, that engaging the women in resilience has been tremendously successful. In Afghanistan, we've hired 6 women who are widows of the Afghan National Security and Defense Forces, and they are now training hundreds of women to understand the resources that are available to them, the hope, the community, the care, and to know that there is a future. As part of this program, we are enabling them to connect with resources and jobs that then allow them to have a stable home life and bring their children up in an educated household. It's a wonderful program, and the love and the healing that has taken place is just absolutely extraordinary. The program is called Kargazar, which roughly we translate to creating opportunities and creating jobs. But it's an opportunity for women to come together and know that they are not alone and become empowered. So the 4 purposes are to honor the fallen, to honor those who have stepped forward to fight for freedom, to give the women an opportunity to have home-based employment in a safe environment, to get an income and to create a home for their families, to connect the widows with the resources and government benefits, and train widows in coping with their grief and understanding this universal language. We know that there are tens of thousands of women who have suffered the loss of a loved one, that grief is disabling on so many levels, and there are so many ways that we can take that pain and that loss and that suffering and that disenfranchisement and turn it to empower women and build communities of hope and understanding. So we understand that when a traumatic loss occurs, it impacts the basic human psychological needs that we have, the need just to feel secure, the need to feel good about oneself, the need to feel effective, empowered, connected to other people, the ability to have trust, and the need to form understanding of the world and their place around in it and around themselves. We understand in war-torn countries, social disruption has been absolutely devastating. It is so hard to bring oneself out of that environment. We've spent time in refugee camps and working with families who are grieving family members, but then on a day-to-day basis struggling just to survive, just to have that hope. When we come together, when we recognize those needs, when we acknowledge what must be done, it is tremendously empowering. It is incredibly important that all those grieving the loss, all those who have experienced trauma, find first and foremost safety, learn trust, feel self-esteem, reestablish intimacy, gain control over their environment in whatever way they can. And finally, to find meaning and purpose in their lives once again. These are simple things that can be incorporated in any practice in supporting any who are feeling the effects of trauma in society. So the long-term goals of our program are very simply to address women's emotional and physical issues, to bridge the communication between not just the widows of a particular country, but by widows of all countries and all faiths, coming together across religion, beyond language barriers, to create employment opportunities and hope for the future. So the services that we're providing through TAPS as an NGO is that the financial security, literacy and vocational training, access to resources and support, comfort and care to the widows. So we are proud that there is hope. We recently, in August of last year, had the opportunity to go to Mosul, Iraq. I spent a year in Baghdad in 2003 and 2004, and at a time when it was tremendously hopeful then on the reconstruction and the rebuilding. To go back now in 2017, at the time when the ISIS flag was coming down in Kurdistan and the Iraqi flag and the Kurdish flag were going up, was incredibly moving and powerful. And to go to refugee camps and to see families who had suffered so much, who were grieving the loss of their loved one, but also grieving the loss of their homeland, of their society, of their friends, of their possessions, and to offer a glimmer of hope, of now helping a movement to rebuild and reestablish a stable society. It's absolutely tremendous. So we teamed with government and private sector leaders, and we continue that work. We are in 23 countries, and we are seeking, as I said, to expand that. I want to share with you a film clip of our trip to Iraq and give you just a little more insight into the work that is being done, the hope and the healing and the empowerment that is taking place for those who have suffered so much.
TAPS is America's family of all those who have suffered the loss of a loved one in military service. We have almost 1,000 who have lost a loved one in Mosul. For them, there is nothing more important than giving meaning and purpose to their loved one's life, their service, and their death. To make it count, to continue the mission, to give them that living legacy. Our team from TAPS is here in Mosul, had the opportunity to go to the refugee camps. We saw families who were living in just little rooms piled in together with barely anything to eat and no possessions at all. What TAPS can bring is a bit of psychosocial support, the emotional healing, the opportunity to provide trauma treatment for the psychological harm that has been done, the connections with others who have also suffered in this shared mission.
We met a family that was new to this camp, and when we walked into the tent, there were these beautiful drawings of flowers and butterflies in the ceiling, and it really struck me. The father was trying to make a place more safe, more just beautiful for his family to live in. The human spirit is able to conquer so many things. It's able to bring beauty into ashes. We can do our part to bring aspects of humanity, of beauty, of nourishment to other people.
And your house was destroyed. What we saw in these refugee camps were families that had tremendous need, but there are things that we can do to ease that struggle for them. We have a very simple solar panel. It flips out, can stand up on a shelf. There's a little USB light that can be attached to it so kids can read their school lessons, after dark. To be able to provide something as simple as this would be a game changer.
This isn't just a story about people on the other side of the world. It's all of our story. Their mothers, their fathers, their sisters, their brothers.
We have seen unimaginable devastation in Mosul. But what we have here is an opportunity also. It's an opportunity to honor what is left and build something new nearby. To create for these children the chance to grow up with the latest technology. To really give the next generation a whole new world to live in.
So thank you. Thank you for allowing me to be part of this conference, for welcoming us into your family, to letting you know this small effort that is taking place from those who have suffered to those who are suffering. I'm sorry to be emotional, it's just so important. The work that each one of you are about is transformative. What you are doing here, what you've done by coming together at the Institute of Peace in Washington, is take a stand to say that each one of you will make a difference, that you will commit, you will create community, you will do it with compassion, and you will make a connection around this world that will be felt. In July of this year, we are inviting all of the countries that we work with and any others who would like to join to a global summit for those working with the widows of war. It's our small way of bringing the world closer together, of transforming pain into hope and giving healing to those who have suffered. So I just say bless you for what you have done, and thank you again for allowing us to share our mission with you this morning. We are very grateful. Thank you.
Thank you, Lonnie, for that presentation. It's moving and very important, so thank you. We're going to move on to our last presenter, Vabren Watts. Unfortunately, we're not going to have much time for questions and answer, but if you do have questions, please do feel free to find any of the presenters in the hallway or in our networking area or during lunch. Thank you.
Thank you. I'll keep it as brief as possible. But before I actually start, I would like to just say that I'm very blessed to be here among you all. And I thank you for the other presenters. It was very, very touching. Today, our CEO and medical director was supposed to be here, but of course, we're having a grand opening at APA. And he tasked me, Vabren Watts, I'm the Deputy Director of the Division of Diversity and Health Equity at the American Psychiatric Association. But before I get into it, I would just like to thank the Institute of the Muscle Mental Health Conference for allowing us to co-sponsor this with you, along with the University of Michigan. So this conference is
Michigan State.
I'm sorry, Michigan State. You know what, we had that conversation last time, I'm so sorry. So this conference is very dear to the APA because, as you may know, this is a byproduct of APA programming. So APA has 8 fellowship programs that give residents in psychiatry the opportunity to work with Congress on mental health policy, conduct research, and expand access to care to minority and underserved populations. Approximately 10 years ago, a fellow by the name of Farah Abbasi was awarded the APA-APF SAMHSA-funded Minority Fellowship, which provides a stipend to develop a project. Dr. Abbasi used this project as a stepping stone to lead a discussion on the mental health status of Muslim Americans and strategies to offer culturally adapted mental health services to this population. That stepping stone evolved into the Muslim Mental Health Institute, where we are meeting at this very moment. Thank you, Dr. Abbasi. So one of APA's strategic initiatives is to advance the field of psychiatry by improving the workforce diversity and reducing mental health disparities. And this program is actually doing just that. Due to the current social climate that affects our Muslim brothers and sisters, the American Psychiatric Association is tasked with developing resources for psychiatrists to treat this population. One thing that I learned in this position is that a lot of psychiatrists do not know, do not have training on diverse populations. The Muslim population being one of those. So in my division, we were tasked with developing educational resources to teach them. Because as we know, by 2050, the United States will be a majority minority country. And so with that, psychiatrists or any physician will interact with a minority. The first thing that we're doing, we're providing a very basic, just a culture of the Muslim community. And we actually have one of the contributor of that resource here today, Balthazar Adam, which please stand up, psychiatrist in Missouri, Columbia, Missouri. Thank you for contributing your wealth of knowledge to the American Psychiatric Association. As I reviewed the toolkit in the educational resources, we talk about Islamophobia. We talk about how, as you mentioned earlier, the Muslim population is not a homogeneous population. It's very diverse, and people need to know that. So it's very important that we, as the American Psychiatric Association, take the lead as a medical organization to let people know that it is important to offer culturally sensitive health care to patients. Another thing that we're doing, we're also doing a toolkit on trauma related to the social and political climate. This is very important because we get psychiatrists coming to us saying, well, you know, we have a lot of PTSD in a certain population due to, you know, the proposed legislation that currently and unfortunately are discriminatory towards certain people. So that's one thing we at the American Psychiatric Association will continue to do, is to speak up for the underserved and those marginalized communities, and make sure that every patient gets equal access to high quality mental health care. If you are interested in contributing to our educational resources on the Muslim population, please let myself know. My name is Vabren Watts, and I have cards afterwards, or you can talk to Dr. Adam or Dr. Abbasi, or they can contact me. But once again, I would just like to say I'm thankful to be here among such beautiful people. Thank you so much.
Thank you. Thank you to all of our speakers. We do have a few minutes, but I want to make sure we have time to get to the sessions. And if you have questions,